Type 2 diabetes is a common condition that affects millions of people worldwide. Its prevalence is increasing globally, especially because of the rising rates of obesity and sedentary lifestyles. Hi, and welcome to MediStop, the channel where we discuss various health topics. Today we are going to talk about the symptoms, diagnosis, and how you can manage type 2 diabetes. What is this illness? Type 2 diabetes is a chronic metabolic disorder, in which the body becomes resistant to insulin, a hormone that regulates blood sugar levels. As a result, this leads to high levels of glucose in the blood, also known as hyperglycemia. For educational purposes, we will choose Fred to be our main character in this story. So, meet Fred, a 55-year-old hard-working man, who owns his own business, and he's doing great with his job. Because of Fred's busy schedule, he didn't make time to take care of his health. He ate high-calorie foods, a lot of snacks, and almost never did physical exercises. What are the signs of this illness? He started experiencing some unusual symptoms. He felt thirsty all the time, even after drinking plenty of water. He also had to go to the bathroom more frequently than usual, especially at night. Fred also noticed that his vision was becoming blurry, and he felt fatigued all the time, even after a good night's sleep. Remember, type 2 diabetes is a very serious condition. It can affect more parts of your body, such as your heart or your eyes, by being involved into the atherosclerosis process. Speaking of symptoms, if you are curious to find out what are the symptoms of the autoimmune diabetes, click on the pop-up in the right corner. Maybe you will like it. How can you diagnose type 2 diabetes? After some time, Fred decided to see a doctor to get his symptoms checked out. The doctor performed a series of tests, including a fasting plasma glucose test, which measures the level of glucose in the blood after an overnight fasting. If the result passes over 126 milligrams per deciliter, Fred can have diabetes. In addition to that, the doctor performed a hemoglobin A1C test, which measures the average level of blood sugar over the past 2 to 3 months. In this case, if the value of glycated hemoglobin is higher than 6.5%, it indicates that his blood sugar levels were consistently high, confirming the diagnosis of type 2 diabetes. The doctor explained to Fred that type 2 diabetes occurs when the body becomes resistant to insulin. As a result, the body cannot effectively regulate blood sugar levels, leading to a range of health problems. Before moving forward, if you liked this video so far, click on the subscribe button to never miss more content like this. How can you treat this disease? Fred's doctor prescribed medication called metformin to help his body process sugar more effectively. Metformin is an oral medication that is commonly used to lower sugar in the blood by increasing the insulin sensibility and reducing the rate of gluconeogenesis in the hepatic cells. Moreover, metformin slightly influences the appetite and the body weight. However, medication alone was not enough. He needed to make some lifestyle changes to manage his condition more effectively. Fred's doctor advised him to make some dietary changes, including reducing his carbohydrate intake and increasing his consumption of fiber-rich foods. The doctor also recommended that he increase his physical activity, including regular exercise such as walking, jogging, or cycling. Fred was also advised to monitor his blood sugar levels regularly to keep track of his condition. Type 2 diabetes is a serious but common condition. Fortunately, there are plenty of treatments available that can help you live a normal, long, and happy life. Don't do what Fred was doing before his diagnosis. Do what Fred was supposed to do to prevent it from happening. That would be it for today's video. I hope you enjoyed it, and if you did, hit that subscribe button. Don't be shy to show your thoughts into the comment section. Thank you for watching and see you in the next one.